Greetings, everyone. Today is Friday, June 12th. Happy Friday to everyone. It looks beautiful outside. I am looking forward to the end of the workday and being able to walk my dog. So I know that last week, Friday, we had a great update on mental health, and so I took that to heart, and that will be my plan for today. Luke Feedy again joins us to do that mental health check-in. There are lots of challenges right now in our community that are COVID-related, as well as other big issues that we are all working through and facing. One of the things I think we need to remember is that we can walk into those things with a positive mindset and an intention. And I have to remember regularly to meet people and understand not what's wrong with them if they're behaving in a way that is a challenge, but what's happened to them, and thinking about that is important. I know I have work to do on that, and I think we can remember that mental health is impacting many of us, and to enter into relationship when we're communicating with people with that in mind. This weekend is Flag Day. So on the 14th, on Sunday, it will be Flag Day. The day commemorates the adoption of the official flag in the U.S. in 1777. So a reminder about that. I'll share a little bit about state status updates, a little bit about what's happening here locally, and then again, Luke will share a bit more with you as a mental health update. So the state status update. The total negative count for COVID-19 testing now is at 377,362 negative tests, an increase of over 11,000 negatives since yesterday. The total positive count is at 22,246. That is an increase of 320 since yesterday. The total hospitalized patients is over 3,000, an increase of 27. And again, that number keeps increasing, as well as the number of total deaths. We are nearing 700 now as a state. So again, a reminder with an increase of 7 more people since Thursday that people are negatively impacted by this disease in a very significant way. On Thursday, the Department of Health Services reported that there are 66 labs with daily testing capacity of over 16,000 tests. They've been running fewer tests than that on a statewide level, but it's certainly the goal to increase testing capacity and to increase testing that we are doing. There continues to be some increased testing, both at a state level and as well as locally, but we need to continue to do that work. Some of this testing is outbreak testing across the state. Others is related to the prioritization of community testing for long-term care facilities. We've talked about this previously, and continuing the important work of symptomatic testing. They're all public health priorities, and while we know other testing is also happening, we really want to make sure in this community that those that need a test get a test. So anybody that is symptomatic, please make sure that you prioritize that so we can slow down the spread of this disease. The state positivity rate has been right around 3% these past couple of weeks. That rate continues to decline as our testing numbers go up. We will have broader testing happening with people that are mildly symptomatic or not symptomatic, or people that are being tested because of our long-term care plan to test everybody that is in those settings to make sure that we decrease the spread of disease. It doesn't mean that we have fewer cases. Our case numbers do continue to go up as a state, but it does mean that of the tested people, a lower percent is coming forward as positive. In our own county, we do continue to have concern about the metrics that show while our positivity rate is not, again, getting concerning, that we have outbreaks happening with people gathering and community spread with the cases that we are seeing. That community spread is, again, related to people that don't know where they got sick. It's not someone that they knew in their family or in their small social network or work network that they were exposed to, but where they really don't know where they got disease. We shared with you previously that community-acquired disease is something that we are seeing at a fairly high rate in Eau Claire. So the Eau Claire update about data. So again, we report this regularly every day. It's updated on our local website as well as the state website. COVID-19eauclaire.org is the place where you can get not only what I share with you on these media updates, but regular updates on the broad data that is available to us. Negative tests for COVID-19 in Eau Claire now are at 6,326, an increase of 76 since Thursday. Positive cases are now at 130. We had 4 additional cases since Thursday. Recovered are at 106 individuals who have gotten through their isolation time and are now, as the state tabulates them, considered to be recovered. New on the website is racial and ethnic data for cases, and our positivity rate is also there, which is a little over 1%. The ongoing data that we share with you is important, so I would encourage you to look at that. You will see that disease remains in this community, and we are tracking that carefully, and the website has that information available to you. The state updates, just a couple of them for you today. The governor briefing recently talked about testing again. The goal is to get tested if you have any symptoms. We really want to catch disease early, and that is one of the ways we can get that to happen. The governor also encouraged people that were in large groups, whether it was a protest or another large gathering, to make sure that even if they are feeling healthy, that they get tested after going to those large group settings. The encouragement given by the state is to do that within a week or so of that gathering, and then if that test is negative, to then do a follow-up test another week later. Everyone should be monitoring themselves for COVID-19 symptoms, and certainly large public gatherings are not recommended. It is census year, and in a typical year in the late spring, we would be seeing census workers being out and about and doing door-to-door interviews with residents. That happens so that we can have really strong information for our local census numbers for Eau Claire County. That work, door-to-door, and that in-person interview process has been on hold, obviously, with COVID-19. The Census Bureau, though, has announced that they will now restart going out door-to-door, dropping off packets, so not having that person-to-person contact, not that contactless tracking of the data is really their goal. If you get a packet on your doorstep, or if you've received the information in other ways, please make sure you fill it out. Census data is critically important to our community in all kinds of different ways, and we really want to make sure that we capture that as a community as a whole. Locally, we've had a number of things happen over the course of this week that I just want to remind people about. On Wednesday, we announced a new plan. So a Respond Together Plan, Eau Claire is what it's called. It's really laying out for us how we move forward together as we walk through what happens with disease progression in this community, both as it gets worse and as it gets better. Our goal is to continue to open up the community and go back to a new normal so that we all can be doing the things that we love. This Respond Together plan does walk through step by step how we will look at data and metrics around the disease progression in our community, as well as capacity measures in our community for both healthcare and public health. As we see things manageable, we will continue to reopen, and there's good information at our website about that Respond Together Eau Claire plan. Also at the website is, and again, we've shared this previously, but it connects to the planning document, are the measures that we are looking at and tracking every week. Every week on Tuesday, we pull data for that week. We post it on Wednesday at the website, and that posting really gives you a visual, red stop sign, green and yellow, to show you where we are at as a community with various data points. So again, between the planning document and those measures, we encourage people to really look at that and have better information about what is happening in this community and how we move forward. We also this week, based on the data we are seeing, did update the public health order that we have in place. That update did look at not only the public health best practices that we will be continuing, but some places where we are loosening a bit and having more activity happen. So that was in the arena around larger public gatherings being possible as we start to open up more, and around some of the one-on-one personal services. I would encourage you to look at the website at that specific order and the frame for that around making sure that we keep physical distancing and use of cloth face coverings as an important part of what we do moving forward. The smaller we keep our circles and the more we use basic public health principles, the more likely it is that we will walk as a community together through this pandemic in a way that is safer for people that otherwise might be impacted by increased number of hospitalizations and deaths that we're seeing in other parts of the world. So we now have Luke Feedy sharing with us a bit about resilience, and I will be back afterwards to answer questions.
Thank you, Lisa. Happy Friday afternoon to everybody. Resilience has been a buzzword in mental health for a number of years. Oftentimes it's defined as the capacity to recover quickly from difficulties or adversity. Resilience is something that we're born with, and it's also something that we continue to build throughout our lifetime. As children, we have opportunities to build resilience in a number of different ways. We can do this through meaningful activities, including sports, camps, our schooling. These activities allow for children to work with others, learn how to team, build connections with others, and deal with challenges with the support of others, friends around them. As a result of COVID-19, we know that a number of these activities, sports, camps, even schooling, have been postponed or canceled, and children don't have the same access they did before. We count on these activities to really help our children build resilience and develop those support networks. In the absence of those activities, we're challenged to think about different ways that we can help our children continue to build resilience and in turn build resilience ourselves as well. So these are some following suggestions that really work across the lifespan, both for children and for us as adults. The first, focus and foster your connections. Take time to build upon the valued relationships that you have in your life. Oftentimes when we feel depressed or anxious or upset, those are the moments when we tend to isolate, withdraw, and not reach out. These are the times when it's most important for us to connect with those individuals that love us and care about us and that we care about. This can be done in many different ways. You know, we have so many more options now today than we ever did before. We can call on a cell phone. We can video conference with our friends and family, or even have a socially distanced get-together face-to-face. We have many options and nobody has to struggle alone. The second really important tip is to be productive. Now this seemingly can seem like a small task, but every day it's important that we have goals that are feasible and attainable for us. The important piece of this is that our goals are feasible. Like Lisa said, perhaps today I make a goal to walk my dog. And that can be one thing that helps me feel like I've done something throughout my day to be productive. Completing goals and tasks throughout the day help inspire confidence and competence in us as human beings. The third is have hope. Working to maintain positive feelings about the immediate or long-term future, leads to elevated moods, higher motivation. Having hope seems like something that's simple, but it can be very difficult in times of adversity. Having hope does not mean that we do not still have bad days or negative feelings. We can still experience difficulty, but having hope is working to view those silver linings, to understand that there is some silver lining in those gray clouds, and not spend as much, or at least an equal amount of time, focusing on the positive as we do with the negative. Part of hope is giving that same attention to each, positive and negative, every day. Modeling hope is a very important piece of teaching resilience to our children, as well as to others around us. It's important to figure out what works well for you and practice a number of different skills. If you have things that help build your resiliency now, continue to focus on those things, continue to build them, and be well. Have a great and resilient weekend. Thanks.
Thank you, Luke. I think one of the things I'll take from that is that being productive is a good thing, and I'll remind my 19-year-old son that being productive with his laundry might be a really good strategy for resilience this weekend. So I will tell you that the virus is still with us. We are still seeing increased cases. We've seen outbreaks and increased numbers across the state. We do need to pay attention to that, and we continue to watch it. COVID-19 eauclaire.org is the website to get more information, and certainly the call center number 715-831-7425 continues to be a number to call if you have additional questions. Please check our social media sites for more information as well, and we'll be back on Monday and Friday next week. So questions? Yeah. So the question is, we've seen a slow progression of cases over the last couple of weeks, not big spikes in cases, and do we see that things in Eau Claire County are evening out a little bit, and what do we think about that? The trajectory of the disease continues to be on an upward slant, and of course positivity rate, which is what part of the question, is really related to the number of tests we are doing. We are doing a lot of testing right now of asymptomatic individuals because of our focus on long-term care testing of all residents and all staff. One of the reasons it appears that our positivity rate is remaining low is partly related to that. Our nursing homes and long-term care facilities have done a really amazing job of making sure that disease does not spread there as much as they possibly can. We've got a great team here. So we're not finding a lot of cases with doing that asymptomatic testing. Those things that we have put in place, all of the pieces that you have been hearing about for the last number of months, but now locally for the last couple of months, they're working. It makes a difference when we physical distance. It makes a difference when we stay home when we're sick. All of those public health measures, the requirements that we have in Eau Claire do make a difference. And my ask to everybody is to continue to really keep each other safe. That's our goal. We will continue to see spread of disease. I will be surprised if it entirely flattens out. We still are not immune to disease, but it will be hopefully a slow progression. Yeah.
With all the protests going on, obviously social distancing hasn't been possible with gatherings in the house across the country. If we don't see a big spike across the nation or, anywhere localized, how telling is that with this disease, the fact that people have been gathering in large masses and not seeing a huge number? Because how important is that information?
Yeah. So the question is related to, with some of the large gatherings, especially the protests that we've been seeing more recently where large numbers of people are together, if we don't start seeing increases in disease numbers that may be related to those types of gatherings, what does that mean to public health? We are certainly watching that carefully. We certainly see disease spread when close contact happens. The kind of close contact that happens in certain work situations is longer duration and closer than in some of those outbreak situations where we see that, or in a living situation, a congregate living situation. Certainly the dynamic is different in those spread situations. Whether or not being outside, whether or not having shorter term contact with the people that are most closely around you makes a difference is something that we certainly are watching in the public health community. We do know that when gatherings like that are such that people are both wearing a cloth face covering, the potential for transmission appears to be a bit lower. So again, as much as possible, having contact closely with people and be minimized, making sure that people stay home if they're going to events like that and they are not feeling well, making sure that people really follow that basic common sense principle. And then use of cloth face coverings, we think, will make a difference. But that is something that we'll be tracking over time and seeing what we see. This is a new disease. The spread of it is something that we know can happen with close contact, so that's part of why the measures are in place that are there. Yeah. So the question is related to what have we seen with cases since the Safer at Home order, which ended in May. Again, we have a community that has had a progression of positive cases over time. You may remember that back in April, I believe, we had a number of days and weeks where we had very, very few cases increasing. That has changed. We really, every week, have had increased disease. Almost every day, we've had a number of increased cases. And we expected that with the change in the Safer at Home order, with the change in people keeping their circles very, very small, that we would start slowly seeing an increase in disease. We have things in place in this community to keep that spread slow. That is the intent around our current recommendations and requirements. And the intent is to keep the progression very slow. We don't want to overwhelm our public health system or our healthcare system by having an enormous spike in disease, and that has happened. We have had small instances where we've had small outbreaks, small situations where we've had spikes in positivity rate and spikes in disease cases. Some of those were in May, right after the Safer at Home order was lifted. So we really think that people are paying attention for the most part across the community, and we're really counting on that continuing. Yeah. So the question is really related to newly reported county level data on race and ethnicity. Our counts were small enough previously that that data point was not displayed. We are seeing disproportionately people of color impacted by COVID-19. That has been consistent across the state, that has been consistent across the U.S. There are many reasons that that is in fact true, none of which have to do with the virus itself. People of color are often people that for all kinds of social reasons are in jobs, are in living situations, or are in other circumstances that mean that they may be more exposed to disease. And it's again one of the reasons why we talk a lot in public health about racism being a public health issue. The reason that people don't have opportunity often is related to our institutional policies in a community, across the state, and in our nation. And people of color are disproportionately impacted with that. We also know that there are small things that happen in healthcare settings that also may be contributing. We don't know, we haven't been able to, with our small numbers, analyze the data carefully, but we do know that race and ethnicity does make a difference for people entirely because of social constructs, not because of anything being different about the disease in those individuals. All right, thank you very much, everybody. We will be back to share more information with you next week. We hope people stay well and have a healthy and enjoyable weekend.